Environmental Conservation every Wednesday, 8 to 9 p.m. here on WeFM 99.9. Your Health Matters. Ask Dr. Thompson any burning question you have related to health. Your Health Matters. Dr. Thompson will examine healthcare, highlight important environmental issues, and look at what's hot in science and technology and the next wave of emerging diseases and health trends. So this and every Wednesday, join us 8 to 9 p.m. here on BFM 99.9 because your health matters.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
And good evening. Oh my, sorry about the little late start today. This is Your Health Matters. This is Dr. Gerald Thompson. Every Wednesday, 8 p.m., Your Health Matters. And remember, this is interactive 457-9997. And you know, normally I have a monologue, but today we have a very special guest. I want to say that in general, men and women have some of the same type of diseases, but women may have a few things that need to have some special attention. And of course, pregnancy, menopause, conditions related to the female organ, issues of bone density, the bone density, osteoporosis, wound healing, and all these sort of things. And today, I have a very special guest. Her name is Hazel Stewart. She is an advanced nurse practitioner. And actually trained as a nurse prescriber. Doctors are the ones who know, but a number of nurse practitioners and so are able to prescribe. And she's also an acupuncturist, a reflexologist, masseur, microneedling, and basically a specialty in terms of microneedling in relation to the face, hair loss, and things like that. But she focused a lot on women's health. And I'm really pleased to have her on the program. I think I want her to say a little bit more about herself because I could never do justice to these individuals. So Hazel, thank you very much for being on the program. Sorry about all the technical issues and so in the beginning. We were just from starting exactly at 8. But tell us a little about yourself and let's dive straight into what we're going to talk about today.
Hello, everybody. Thank you so much for having me in your show, Dr. Thompson. So my name is Hazel Stewart. I'm UK born, as you can hear from my accent, but my parents are proud Vincentians. So I'm proud to call myself a Vincentian, British Vincentian. So I've been called to St. Vincent, actually, and I would just like to read a few lines about my journey here. I answered the call of my womb and crossed oceans. I left behind the noise, the grey skies, the constant doing, and landed in the lush arms of St. Vincent, where my body could exhale, where the sun kissed my skin like a blessing and the sea mirrored the fluidity of the inner world. This is not an escape, this is a return to rhythm, to softness, to ancient knowing. Here in the sacred heat of St. Vincent and the Grenadines, I remembered healing is not a luxury, it's my birthright, and my womb, wild, wise and waiting, is my compass. So I feel that I was led to come here in the later stages of my life. I've been a nurse since I was 18, and I've been a nurse for over 40 years, which is a long time. So I've got a wealth of experience of working with all types of people, but I'm a specialist in women's health, which is what I would like to discuss today. I'm passionate about womb healing. So we see the womb as somewhere, a place in the body, an organ in the body where we have periods every month and we deliver and we birth babies. But the womb is more than that. The womb is an energetic imprint, and it's where we create and we birth ideas. So this is a spiritual, I would say it's a spiritual message about the womb. It's not what we are taught, but in the
And Hazel, let me just stop you here. And
yes,
some persons I may have even said it. We're talking not about wound healing. We talk about womb, the
womb,
womb healing.
WOMB, yes, I need
Yes,
to make it clear.
and the womb is an organ that is in the female body, and we're talking about womb healing.
That's correct.
Okay.
Yes. So it's not something that we often talk about, and it's something that, I think needs to be talked about. I'm passionate about talking about it. So I just wanted to talk a little bit about womb healing. So womb healing is a holistic practice, and it focusing on restoring balance, vitality, and emotional well-being in the womb space. It involves the physical, emotional, and spiritual healing. And I believe, I work on the theory that if issues are not resolved in the womb, it can affect you physically, such as you can end up with having blockages in the body, which can lead into many, many problems, such as irregular periods, painful periods, reproductive problems, getting pregnant, infertility issues, sexual trauma, emotional blockages, which can lead to problems with intimacy. So I believe that healing the womb can help you with other areas of your life, not just your reproduction area.
Yes. Yes. Well, let me try and dig a little deeper into this, Hazel,
Absolutely
because
fine. No
because
problem.
um, the womb,
Yes,
the uterus
yes,
is and when you say healing, what of a younger person who is, let's say, 12, 13, 14, 15, may not be a woman yet, but a young girl who is just beginning to see her periods.
yes,
That involves a woman. What of a more elderly lady, someone
yes,
who is 80, she's already had kids and so forth,
yes.
no longer having kids? What is the difference? I mean, how should they approach their womb, their uterus, as opposed to women of more reproductive age?
So the younger girls, I see them frequently because I worked in general practice. So the younger girls can have issues such as heavy and painful periods. So of course, working in general practice, we would often prescribe medication such as tranexamic acid and mefenamic acid, but medication can cause side effects. People can have adverse reactions to them. So I'm not saying that they shouldn't be used, but I don't agree with using them first line when someone's very young, unless it's very, very exceptional cases. And often we would prescribe the contraceptive pill, the combined oral contraceptive pill. It's all right if somebody wants to use contraception, but we may use it to reduce their heavy periods and their painful periods, but it's a hormonal pill. So I like to offer people alternatives to Western medicine. I'm not against Western medicine. It's what I've done for 40 odd years. But I just think that there are other ways of dealing with womb healing and womb problems. And for example, like people with young girls might have endometriosis, which is very, very painful periods. Endometriosis is the inner lining of the womb is called the endometrium. So it can bleed outside of the uterus, it can bleed in the fallopian tubes, it can bleed in the ovaries, and if that's untreated, that can cause infertility problems. So um,
Mhm.
so that's what I think. With older women, younger women have most younger women, not all of them, because if you've got something like polycystic ovaries, a hormone imbalance, you can have irregular cycles. But the majority of women may have 28-day cycles. And so they have a rhythm every month. And in the old days, women used to bleed all together at the same time with the moon. They used to bleed the same time when it was the moons. That's why it's called the moon cycle. But nowadays, it's not like that. And with the older women don't have periods, but they still have a womb. And even if you have a hysterectomy where you have your womb removed, you still have the energetic imprint of the womb. And I think that the womb is not just a reproductive organ, it's the center of creativity, it's the feminine energy, and it's where women use our intuition. I am not saying that men don't use intuition as well, but I'm sure that many women will agree. Many women are very intuitive and they just know when something doesn't feel right. Um, but I also believe in generational trauma that's passed down from generation to generation. So this is why I'm so passionate about womb healing. And I think it's something that needs to be addressed. People are addressing it more, but only it's not in a wide scale.
Yes. Now, let me ask you, you are a nurse practitioner who specializes in a number of things, including womb healing.
That's correct.
Right. Now, what of somebody who is an OBGYN physician?
Yes.
Why would be the need for a patient to come to somebody like yourself versus going to an obstetrician and gynecologist physician?
So I'm not against them going to the obs and gynae at all, because in my job I referred patients frequently and I work very, very closely with gynecologists. So for example, if somebody came in with heavy and painful periods, I would often refer them to have an ultrasound scan. And, you know, it's very important to have those done. To check for fibroid, to check for any abnormality, most of all to rule out anything, any malignancy. But there are some women that just want to work naturally and not go along to have invasive treatments. So definitely I'm not against obs and gynae. It's vital, we need them. But sometimes I believe sometimes operations are performed unnecessarily, or people aren't informed enough about the operations that may be needed. And I think it's maybe a good idea for them to try alternatives, and then if that doesn't work, then maybe think of surgery. But yeah, we still definitely need obstetricians and
Yeah.
gynecologists. And
Now,
that's what I specialised in. That's what I did a specialist
yeah.
course
Now,
in. Yeah.
there are many conditions that affect women, and
Yes.
as I said, we could talk about, the breast. We could talk about other conditions, but the focusing on pregnancy, menopause, and the different type of conditions that affect the female organs.
Yes.
One condition called PCOS, or polycystic ovary syndrome,
Syndrome. Yes.
seems to affect Black women more than Caucasian women, it seems.
I
And
can't say it does, because 1 in 10 women have PCOS, and
yeah,
I see them vastly in England. But I do know that fibroids is a real prominent in the Black community. But I
yes.
can't say about the PCOS, but I do know I saw someone today with PCOS actually.
Yes.
Um,
Well,
yeah,
well, 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 as you mentioned, fibroids. Is
yes.
there, how does somebody really deal with fibroids? How what advice you would give to a young female, a female who wants to have a child, and can't
Yes.
seem to have it, or those who are having heavy bleeding, as a result of their fibroids, how would you advise them?
So I'm passionate about fibroids. I would highly recommend a change in the diet, omitting red meat especially. It's not so bad if you have chicken and fish, but the chicken, especially that comes in the Western world, is injected with steroids and hormones, and that can increase the sizes of fibroids. Trying to watch your diet, eating a healthy diet, trying to not be overweight, because when you're overweight, you have more estrogen in the body, and that can feed on the fibroids. I would also suggest exercise, doing regular exercise, which is important. I'm passionate about castor oil packs. So castor oil packs are packs.
No, let's just get that. So you're saying castor oil pack.
Yes,
Okay, interesting.
packs. So I sell a range of castor oil packs that are African inspired, and they're packs that you put onto the abdomen, the lower abdomen, and then you put castor oil in a cloth, and then you put the pack on top, and on top of the pack you can either put a hot water bottle or a heat pad. And what that does in Chinese medicine, we call fibroids stagnation. That means that the blood and the qi is not flowing through the body freely. So when you use these castor oil packs, never to be used during pregnancy, never to be used during menstruation, it helps to break down the fibroids, and it helps to reduce the heavy and painful periods. So that's something that is natural. It's not got any chemicals in it at all, and castor oil is an old ancient practice. And as a matter of fact, in England, I had a young Jamaican girl, and she had a fibroadenoma, which is a lump in the breast, which is benign, it's non-cancerous. And I suggested to her using the castor oil pack, and she'd already been to the doctor, it was already ruled out, it was non-cancerous. And she used the castor oil pack on her breast, and her lump went all together. I'm not going to say that's going to happen for all women.
Yeah.
Any woman with a breast lump definitely should be investigated. So I'm not advocating that at all. I've got to remember my training that I've done, my Western knowledge training, but I
Yeah.
think there's no harm trying castor oil packs.
Yes.
Secondly, for fibroids, I'd also recommend yoni steaming. So yoni is a Sanskrit word, and yoni means vagina. So I think yoni is a nicer word to say than vagina, steaming. And it's an old ancient practice. It's nothing new at all. I know they've practiced it in St. Vincent, because I've spoken to a lot of older women. So after having a baby, women sat over a pail of herbs, hot herbs. And what the herbs help to do is to go through the vagina, up to the cervix, up into the womb, into the uterus. So it helps to get rid of all the blood and lochia that you have after having a baby. So
So
it helps.
where the steam that's
Yeah.
in the hot water comes up and basically does that. Huh?
That's correct. Yes.
That's interesting.
Yeah, very interesting. And they've got
Are you saying after speaking to some older women, they used to do that?
yes.
This is an old practice in St. Vincent?
Yeah, in St. Vincent, in Africa, in Asia, China, Korea, all these countries,
Yeah.
and in Mexico, Brazil, etc. So, but it's very big in America now. So then I've got friends from Eastern European, in Poland they did it, Netherlands, and all these countries. So it's very, very good after having a baby, postpartum, but it can be used for all women, even if you're menstruating or not. So whether you're menopausal or not, it's just a very good, it's very good for menopausal women, because when women become menopausal and due to lack of estrogen, they can get a dry vagina. So it helps to moisten the vagina, and it's very good for fertility, women who are trying to conceive. So that's for fibroids. For fibroids, I also recommend naval moxibustion, and that's a traditional Chinese medicine, and it's burning herbs on the abdomen, and that also works on the theory that there's stagnation and you're clearing the qi and the blood in the body. And then I do something called I practice naval moxibustion, and I also practice navel cupping, and it's applying Chinese cups onto the navel and onto the abdomen, and that helps to clear away stagnation as well. And then I recommend acupuncture. So I'm an acupuncturist. So with acupuncture,
I'll come to acupuncture just in a short moment. I'm still. I just wanted just to wrap this up in relation to the womb. A woman who's had 2-3 children, normal childbirth, everything's going well, the children has gone, she probably has had 2 children, doesn't want to have any more.
right.
Is there a need for womb healing? Having gone through 2 normal pregnancies, you all right, you feel fine? Or is womb healing something for someone who has had more of problems or complications or
Yes. So whether you've had no complications or complications, it's still recommended for you to have it. It's just a good therapy to have once a month. So even if you've had a normal pregnancy, it's still good, because then these women, especially if they're young and they've had 2 or 3 children, we know that when they get into their 40s, they've got higher chances, especially black women, higher chances of getting fibroids. So if you're using the yoni steaming, hopefully it can help to reduce the fibroids enlarging and becoming, many women with fibroids end up getting anemia, feeling extremely exhausted and tired, and some of them have to have blood transfusions or take an iron tablet. So if you can try and prevent that, I think prevention is better than cure.
Yes. Hazel, just on this point, there are a number of persons who would listen to this program and they are enamored by the new hospital being built at Arnes Vale.
I think it's fantastic.
The acute referral hospital, where they're looking for ultrasounds and new modern therapies. And the question is, at the same time, there's been a resurgence in acceptance of some of the recommendations you have been making. But there are going to be persons who will say, no, I want to have more high-tech analysis and tests done, ultrasounds and so forth. And I want a tablet that I can take that will solve my problems, rather than steaming pail with
well, they're more sophisticated than pails now. I sell the yoni steaming seats, so they're a lot more sophisticated than what they used to be. But I'm not against modern technology, because let everybody have choice. If people have the funds, not even the funds, if they want to go along and have testing, absolutely fine. I'm not against it at all. But if people go along and have the testing and they don't want to go and have surgery, they don't want to have hysterectomies, they don't want to have their wombs removed. And I found out now that they don't do endometrial ablation here in St. Vincent, but that's another therapy that's done for fibroids. Yes, let the women do. Let everybody have choice. I'm passionate about people having choice and having free will.
Yes. Well, acupuncture. Now, I'll tell you, a lot of people, when they hear acupuncture, they think...
They get frightened.
No, I think they think... Well, 3 things.
Yes.
You're right. They think of ancient Chinese therapy, one. They think of needles. And let me tell you that Vincentians, I'm going to use the word frayed needle.
I agree.
I have Kamal here in the studio. Kamal frayed needle. I can tell you that.
Does he fray corn, though?
Yeah, yes.
Does he fray corn?
Yes. And thirdly, some people think that acupuncture is just in relation to pain. So tell us a little about acupuncture and what it can be used for, and basically if this is something that is painful or is something quite simple.
So I was working at the ITIL Fest 2 weeks ago, and I did multiple acupunctures on that day. I did an acupuncture point called Yin Tang, which is in the third eye, and you hardly feel it. Everybody said they were amazed. So acupuncture is very fine, ultra fine, sterile needles that are inserted into the body, into acupuncture points. And you insert, if you do a body acupuncture, you may insert 8 to 30 needles depending upon what's being treated. So by inserting the needles into the muscles and the connective tissues, this frees up the normal flow of blood and qi, and it also increases your energy levels. Acupuncture is just so amazing because we work on, in Chinese medicine, it works on the theory that emotions affects the organs. So for example, fear affects the kidneys, and anger affects the liver. So it's completely different to Western medicine, to what I was taught. So it affects, there's hardly anything that you can't use acupuncture for, but it also works on the central nervous system. So it blocks the pain pathway. So it's very, very good for pain relief. So everyone thinks the needles are going to be big, like when you're having a blood test. When you're having a blood test, the blood test needle has got to have a bore in it to allow the blood to come out. But the needles for acupuncture are fine as your hair, as fine as your hair. They're very, very thin. And some of them may be a little bit sharper than others, but it works on the theory it's puncturing the skin. But if you've got a skilled acupuncturist, you will feel minimal pain, because you've got to think, what is the long-term effect I'm going to have? And also it helps you to feel extremely relaxed after having it. So it can help with depression, anxiety, helps with fertility, which I've talked about. I'm passionate about. I give myself acupuncture all the time. So it's worth trying it. I think it's worth trying it at least 4 sessions.
Let me tell you, now the needles, and anytime we talk about needles, I say people get a little antsy about that. These needles are very, very fine. They're not like the needles you get from giving you an injection of medication or so. Is that right?
That's correct.
Yeah.
Yeah.
Now you sent me a picture of a hand, and I'm trying to get it up on screen, but we're having some challenges getting it up on the screen. But we might get there. But tell us a little bit. What's the acupuncture really used for? What is it really treat? Okay, pain. Pain is one thing.
Pain. And it jump starts. What it does, so it's a natural healing. I'm very much into natural healing. So it essentially jump starts the bodies into self-healing by providing micro puncture into the body. It creates the natural healing process. The healing responds to it by forming inflammation, and it just heals itself naturally. And it also releases endorphins, which is the feel-good factor. So after having acupuncture, you feel more balanced, you feel more harmonious, and you just feel so much better after having it. I just think it's worth people having a trial of it. And the reason I wanted to do it in St. Vincent, I think there are a few people that do acupuncture, but there's not many people. But I am totally aware that the Vincentians have a fear. But I hope that by people listening to me, I'm very skilled at what I do. I've been working with needles for 40 years. It sounds bad. It sounds like I'm saying I'm a druggie using needles for 40 years. But I am skilled at what I do. So when you do something regularly, you become competent in it, and I am competent.
Yes. Now I've put up my camera to my phone to my camera, and it shows a hand with various needles. Now, if I'm having pain in my back, those needles have to be put up in my back, or
that's a very good question, Dr. Thompson, because there's some acupuncture points, like one called Lingu Daibai. It works on master tongue theory. He's a different theorist from the normal acupuncturist. And if somebody's got pain in their back, we could put needles in their hand, and it will help with their back pain. So as a matter of fact,
people find that very strange. But you say there are these trigger points. What points you call them?
Yeah, they're trigger acupuncture points.
Acupuncture points. And so by pressing on one of these acupuncture points, you could relieve pain in a completely different part of the body.
That's correct.
But the person who's trained will know which trigger points, which acupuncture points in which to press.
That's correct.
And
Because there are some.
it isn't just that you are pushing a needle in, it's that you're also spinning the needle as well and so forth. There's certain ways of applying the needle.
Yes, there's certain ways of applying the needle, and halfway during the session, you would stimulate the needle to enhance the effect. But for back pain, it's very good to have acupuncture, Chinese cupping, which is placing glass cups with heat on the back, and then it would also be good to have a massage. So the 3 treatments reduces the back pain. Yeah,
I see.
and moxibustion. You can do the burning of the herbs on the back as well. But I'll just tell you this quick story. So I went to Carnival in Trinidad 2019, just before lockdown, and we was on a boat trip, and there was a guy there, a Trini guy, and he had severe back pain. So I said, oh, I can give you acupuncture. So I said, you have to sit down. The man did not sit down. He was walking around the boat with the acupuncture needles in his hand. And then I took out the needles and he said, oh, I can't believe it. I can't believe it. I've got no more pain. I've got no more pain. So he was like amazed that I could put the needles in his hand to help his back. And the way that works, the theory that it works is that we have acupuncture points. Some start from the eye and go over the head and all the way down to the feet. And some start from the feet and goes all the way up to the upper torso. So there's meridians, they're energy centers. So you can put a needle in the foot actually, and it will affect your eye. It will help to improve eye pain or headaches. It's just amazing.
Yes. Now, of course, I'm sure you would accept that there would be a number of people who would think that this isn't going to go anywhere. They're not trying that because this won't work. And they're not going anywhere close to a needle. What would you say? I mean, are we going to open up the lines 457-9997 straight or WhatsApp if anybody wants to pose
I'd love to speak to skeptics. I'd like to. What I think it's nice for them is to just try the Yin Tang, because that's what I did at the ITIL Fest, and people were amazed that it was non-painful and they felt so relaxed after having the treatment.
I'll tell you something. Originally, everybody, I was going to have Miss Hazel Strode in the studio, and I was going to bring in a couch and have the cameras homed in, focus on me, and she was going to perform acupuncture on me.
I think we should still do it. Why not?
Well, you see, the time of night and so forth, it didn't really allow it and so forth. But it's amazing how I have seen acupuncture being demonstrated in a number of places and have been amazed that it works. I've never had it done on myself. I am now experiencing a little pain in my knee, actually quite a bit of pain.
Oh my God, it's fantastic for knee pain.
Yes. Well, but tell us a little about this particular field and acceptance. Acceptance of this. The Vincentians who you have been able to help or apply this therapy, what has been the response?
I hate to say this, but I think the women seem to be a bit more open than the men. And I think it's just education and explaining to them very, very carefully what it does. It hasn't got any side effects. The side effects, it's going to help to reduce your pain, and it makes you feel extremely calm and relaxed. But I since coming here, I am fully aware that Vincentians are a bit more skeptical. So I think with education and word of mouth, if someone has it done and they go and say, oh yes, this pain helped me, then I think that I'm hoping that it will spread more in St. Vincent. But the hand that you just shown there, that's a young gentleman that's had severe thumb pain, and I've been giving him acupuncture every 2 weeks, and he's got a far more range of movement in his thumb, and he's got far less pain, and he's passionate about it, and he has been telling his colleagues about it.
Well, some persons would ask, well, do I have to continue this for another year, rest of my life? Will the pain come back once it stops? What's been the response there? I mean, I know these are tough questions, but
It's
I
a
think
very good question. I think it's a fantastic question. The first few weeks, it's good to have it done at least weekly or at least fortnightly, and then people may then need top up every 4 to 6 weeks. So it's not lifelong, but because people feel so much better, you sleep much better, you just feel much more uplifted. It's like you've been given a boost of energy. And that's what it does as well. It boosts your immune system and it does increase your energy levels.
now this program, persons will be able to review it late tonight or tomorrow and see the entire program. I do have up on the screen right now the hand, and it has about 1, 2, 3, 4, 5. It has about 15 needles in it.
He was so brave.
Huh?
He was very brave. But those are very fine needles, very small
Very
ones.
fine needles,
They're,
yes.
they're hands and feet needles.
But he right. So, but let me say, was there a need for that many needles, or could one needle have done the trick? 2 needles done the trick? I mean, is it that those trigger points? It needed all those trigger points triggered in order to get to the pain?
That's a very good question. Because he's had acupuncture in the UK, he's British Vincentian like myself, so he was used to it. But if somebody was to come the first time and may not apply that many needles, and they have been Chinese acupuncturists that have done surgery with just one needle. But with this guy, he had pain all around the thumb joint. So we have found that applying the needles all around the thumb joint, he's just able to use it a lot more, and he's not in so much pain. He works as a chef, so he's using his hands constantly, having to lift heavy pots, etc. But he's had a very, very good effect from it. If people have had 4 treatments and they don't find it effective, just like with painkillers, I'm a prescriber. If I give someone a tablet and they tried it a few weeks and it's not worked, then we need to think of something else. And I'm not going to say it's for everybody, because it's not for everybody. And there are some people who have got horrendous phobias of needles, but they're very, very fine needles. So I just think it's worth trying it once. If it's for you, try it. If it's not, then leave it.
Some persons would also think that it's something that may be expensive, right?
Yes.
Is it expensive or?
Well, when you think about, I can't believe how many pharmacies there are in St. Vincent, and medication is expensive to buy. The needles are expensive to buy. Then you've also got to think about the skilled practitioner. But I've vastly reduced my fees for St. Vincent. In England, you would pay a lot more. In America, it'd be a lot more. In America, and as well as England, actually, sometimes your health insurance covers your fees. But I don't know if they would do that in St. Vincent if people have health insurance.
Yes.
But I have reduced the fees for here.
Getting back, I mean, you were talking about the wound healing and so forth previously. For women's health, does acupuncture add anything for women versus men?
Yes, so for women, I do fertility acupuncture, and I do for dysmenorrhea.
What did you call it? Was that?
Fertility. If women are trying to get pregnant, they can have acupuncture, and men can have acupuncture as well. I had a young lady, she was trying to get pregnant for 9 years. She did have hypothyroidism and type 1 diabetes, and I gave her acupuncture, and she got pregnant after about 3 rounds. And she's got a little boy, he's 3 years of age. This is in the UK. So I was so happy, and she was so happy, because she'd been trying for 9 years to conceive.
If I wanted to have, I mean, earlier on, you had expressed that, you were becoming senior. Actually, you look as if you don't look a day older than 35.
It's the ITIL.
It's the ITIL. But
yeah.
What I will ask, suppose somebody like me, suppose if I want to have children and I want to have more children, I should say, because I have children, I have grands, and so. But first, I want a new raccoon, and so.
Oh,
You know, what do well? We have a call. We have a call coming in, so let's take the
okay.
call.
Let's take the
And it's-
call. I'm so excited for the call.
Hello, good evening. Did the call come through? Did we lose it?
Oh,
we lost the call. Okay. Yes. How would I? Is it that acupuncture could help me?
so I haven't. I'm not going to be honest. I'm going to be honest with you. I have not done it for older men, but there are acupuncture points that we could use.
Don't be fooled. I'm not an older man. I'm actually.
No, you're not an older man at all.
Come on. Okay, let me say that one back. I know people will hit me on social media. My good friend Kingsley De Freitas, I'm sure he will hit me hard.
Oh,
with
please
that.
don't.
You know?
Please don't, Mr. De Freitas. So there's stuff we can use for prostate. There's points we use for prostate and urinary symptom, urinary problems, male and female. But yeah, there's hardly anything that you can't use it for.
What about women? Can it help? You say in terms of fertility and so women.
Yes, and the menopause. It helps with the menopause as well.
Yeah.
Because some women get horrific symptoms with the menopause. So yeah, it does help with that. Helps with hay fever. It helps with rashes, eczema, asthma. It helps with a multiple array. So I feel really blessed that I've got Western training as well as Eastern training. So in China, if somebody is unwell, they try Chinese medicine first. And if Chinese medicine doesn't work, then they go to Western medicine. But in the Western world, we try Western medicine first. And if Western medicine doesn't work, often we go to Chinese medicine. So it's just a different philosophy.
Yes. That's very interesting. You know, we're coming toward the end of the program. I wish that person would call,
Yes.
but tell me, going back, what would you recommend in general to women in terms of maintaining their health? I mean, it spans all aspects of their health, not just womb health.
Yes.
But in general, what can you recommend?
I think the first thing is self-love and looking after yourself and putting yourself first. Doesn't mean that you shouldn't love your partners and your children, but when you have got a full tank, you're able to help other people. So I think it's very important for women to get a good 8 hours sleep if possible, resting, eating a really good healthy diet. If you eat meat, try to have at least 3 to 5 portions of fruit and vegetables daily. Try to do exercise. Doesn't mean you have to go to the gym. Swimming is fantastic. Walking is also fantastic. Trying to watch your weight, trying not to be overweight, and taking some time out for yourself. That's what I think. If you can do yoga is very good. Yoga stands for union, and union of the mind, body and spirit. I know there are some people who are against yoga, but it's basically just gentle stretching and exercises. That's what I would say. And have acupuncture or have massage, but have something that makes you feel good, because we have such busy lives these days and we don't always take time out for ourselves. And I think it's vital to do that. And I try to practice it myself.
Yes.
Drinking lots of water, coconut water especially, full of electrolytes. Yes.
And in terms of, if there are persons who are having pain and it doesn't seem to be handled by what the current physician is doing. First of all, are physicians referring patients to you for this? And secondly, how can somebody who's fed up of the pain they're having, how will they access the kind of pain therapy and so you may be providing today?
So that's a very good question. In the UK, we've got the NICE guidelines, National Institute for Clinical Effectiveness, and they recommend acupuncture for back pain mainly, and for pain relief. So in the Western world, they do recommend acupuncture. In St. Vincent, I haven't got affiliated yet with the doctors, but I hope that doctors are listening to me. My website, I'm going to spell it out, is Alafia Holistic, and Alafia is a Yoruba word, and it means peace, tranquility, well-being, and then it's used as a greeting, and you say Alafia, and then they reply back saying Shay Alafia Nay. That means the greeting is returned back. So my business is called Alafia Holistic Therapies, and I'm on Instagram and TikTok, Alafia Holistic 14. So people can always contact me there. Even if they just want information, I'm happy to talk to them. But I really would like to expand my business here in St. Vincent and see where it goes.
Yes. Well, look, Hazel Stewart, notable Vincentian nurse practitioner and prescriber out of the UK and essentially back home in St. Vincent and the Grenadines. Very interesting topics. We're going to be looking at a couple of these type of things and so forth, in the upcoming weeks. But Hazel, I want to thank you very much.
Thank you for having me on your show. I'm really grateful.
Yes. Sorry about the late start and so forth, but I think we got through. I think we packed everything. And I was able to show that hand.
Wonderful.
So thanks to Kamal, he was able to get a hand up. That's my technical thing. Thank you very much. And do have a good evening and good night, everybody. And stay safe. And women, please take care of yourself. Take care of your womb. Thank you. Good night.
Thank you. Good night. Bye-bye.
Your health matters.
How much do you know